Assalamu alaikum and good morning to everyone. Today we'll study about new chapter, that is antibiotics, and in antibiotics we'll see about the penicillin. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss history and mechanism of action of penicillin, give classification and explain pharmacology of penicillin. So let's see first the story about the penicillin. So I have story to tell about the penicillin. So let's see about the story of the penicillin. So in 1928, the scientist named Alexander Fleming, he observed that the culture plate on which staphylococci were grown. So he has grown the staphylococci in the culture plate, and in the culture plate where he has grown the staphylococci, he also had the mold of the genus Penicillin. So he observed that a culture plate on which staphylococci were being grown had become contaminated with mold of genus Penicillium. So there is mold of genus Penicillium. It was contaminated in the culture plate of the staphylococci. Okay. Bacterial growth in the vicinity of the mold had been inhibited. So when he has seen that, especially in the bacterial growth which is in vicinity of the genus Penicillium or in the vicinity of the mold, he observed that there is no growth in the vicinity of the mold. So this clearly indicates that there is no bacterial growth because of the genus Penicillium mold, which may be producing certain substance, and this substance, it is producing antibacterial effect. So due to the substance produced by the genus Penicillium, that is penicillin, there is inhibition of the growth of the bacteria. So he has isolated the mold in the pure culture, right? So now here this mold which was present in the bacterial culture, it was due to contamination. Now since he has observed that in the vicinity of the mold there is no bacterial growth, so what he did, he has isolated that mold into the pure culture. Okay. So now there is isolation of the mold into the pure culture. And then first clinical use of penicillin he has demonstrated. So its remarkable antibacterial effect in the human were demonstrated in 1941. So what he did, a small amount of penicillin that he had extracted from the crude culture in the laboratory. So that small amount of the penicillin, so he has given that penicillin to the person who has suffered from the infection. Okay. So there was the policeman. He was in the great pain and was desperately ill. Okay. That time sulfonamide, it was only the drug was available, but the sulfonamide were available but would have had no effect in the presence of the pus, because he was suffered from very severe infection and he was having very severe pus, and you know that the sulfonamide does not show antibacterial effect in presence of the pus. Okay, so although he was in a great pain, but there was no treatment in presence of the sulfonamide. So what he did, he has given IV injection of the penicillin, okay, every 3 hours to that particular person. So for every 3 hours he has given IV injection of the penicillin to the policeman who was suffered from the staphylococcal infection. After 5 days, I'm sorry, there was some disturbance. After 5 days, the patient condition was vastly improved. His temperature was normal. He was eating well. Resolution of the abscess. So there was no abscess, there is no pus formation, and slowly the patient start recovering from the infection of the staphylococci. There is no toxic effect of the drug, and then slowly the supply of penicillin ran out, because now penicillin, because he has just isolated that penicillin from the bacterial mold, now there is no more penicillin was available. After there is shortage of the penicillin, his condition gradually deteriorated. So that patient condition starts showing deteriorating, and he died a month later. So in this experiment, what has been proved that the penicillin has antibacterial effect, and due to the antibacterial effect of the penicillin, the policeman who suffered from the staphylococcal infection, temporarily there was the relief to that particular the policeman, and he has started showing the symptom of the recovery. But unfortunately, due to the shortage of the penicillin, that time the scientists were not able to save that particular patient. Okay. So this was about the history of the penicillin, and this was the story behind or the accidental discovery of the penicillin. Now let's see about the mechanism of action of the penicillin, how this drug work, although it is called as the magic bullet, but how this magic bullet works, so that we'll see now. Okay. So you can see in the diagram, so this diagram, it is of the cell wall, and this cell wall, you can see this is something like the bacterial cell wall. Okay, so it is like the wall of the room. Okay, so these are the walls, and these walls are supported by the peptide linkage, and since these are supported by this peptide linkage, all these peptide linkage, they are called as peptidoglycan. Okay, and the penicillin, it is interfering with the peptidoglycan. Now let's see how penicillin interfering with the peptidoglycan. So all beta-lactamase antibiotics, they interfere with the synthesis of bacterial cell wall peptidoglycan. So what they are doing, they are specially interfering with the synthesis of the bacterial cell wall peptidoglycan. Now let's see how it interferes with the cell wall bacterial peptidoglycan. So first, when drugs goes into our body, the penicillin attached to the penicillin binding site on the bacteria. So this binding site is termed as the penicillin binding protein. So where penicillin go and the bind. So in this diagram, this is the site of the action of the drug. So here penicillin will go and it bind to the penicillin binding protein, which is specific only to the penicillin. Okay. Once it bind to the penicillin binding protein, it inhibit the enzyme called as transpeptidase. So there is inhibition of the enzyme called as the transpeptidase enzyme. Okay. Now what is the role of this transpeptidase enzyme? This transpeptidase enzyme, it is responsible for the cross-linking peptide chain which is attached to the backbone of the peptidoglycan. Now I have shown you in the image, these are the peptidoglycans. What they are doing, they are supporting the cell wall of the bacteria. Okay, and the transpeptidase enzyme, it help in cross-linking this peptide chain. Now you can see this is one peptide chain, it is cross-linked with these peptides. Okay, and together they provide support to the bacterial cell wall. Now if there is inhibition of transpeptidase enzyme, there is no cross-linking of peptide chain attached to the backbone of the peptidoglycan, and as a result of that, there is disruption of the cell wall. Okay, so the cell wall will be disrupted, and I'm sorry that is not seen in the slide. There will be the lysis of the cell wall, and it inhibit the growth of the bacteria. Okay, so this is the mechanism of action of the penicillin. Now let's see about the classification of the penicillin. So there are different types of penicillin. So first kind of penicillin, it is the naturally occurring penicillin, that is also called as the benzyl penicillin. So benzyl penicillin, it is the naturally occurring penicillin. Then semi-synthetic penicillin you can create by adding different side chain to the penicillin nucleus. So in the penicillin nucleus you can just change the group, and due to change in the structure of the penicillin, there is change in the activity, and you get different derivatives of the penicillin. Let's see what are those derivatives. So basically penicillin is divided into two categories. One, it is naturally occurring, that is benzyl penicillin, and when you do structural modification in this naturally occurring penicillin, you will get semi-synthetic penicillin. So these are different semi-synthetic penicillin. First category is the beta-lactamase resistant penicillin, example the flucloxacillin. Second one, it is the broad spectrum penicillin, example ampicillin and amoxicillin. And third, it is extended spectrum penicillin, example carbenicillin and ticarcillin. So although the basic structure is same, just you have changed the group in the R1, that is alkyl group you have changed, and due to change in alkyl group you get different structure which having different spectrum of activity. So here you can see the flucloxacillin, it is the beta-lactamase resistance, then broad spectrum penicillin, example ampicillin and amoxicillin. Then you also get more extended spectrum penicillin, example carbenicillin and ticarcillin. Okay, so this is all about the classification of the penicillin. Now let's see about the penicillin pharmacology in detail. So let's start with the naturally occurring penicillin, that is benzyl penicillin. So benzyl penicillin, it is active against wide range of the organism. So that is the good activity of the benzyl penicillin. The most of the organism they are inhibited in presence of the benzyl penicillin. Okay, and it is the drug of first choice for many infection. So when persons suffer from infection, the benzyl penicillin, it is the first choice drug amongst all the penicillin. Let's see what are the drawback of this kind of penicillin, naturally occurring penicillin. So first and most important drawback is that the benzyl penicillin, it having poor absorption from the gastrointestinal tract. Now this is the major limitation, because the preferred route of drug administration, it is through the oral route. Now since it having the poor absorption from gastrointestinal tract, it must be given by the injection. So IV injection is needed. So maybe sometime patient need to be hospitalized, or maybe he has to need the intervention of the expert to inject the drug. So that is the main drawback. Second important drawback about benzyl penicillin, it is that it is the resistant to the beta lactamase enzyme. Okay, and we'll see that in a detail in the subsequent lecture about the resistance related to beta lactamase. Okay, now we'll see about the pharmacokinetics. So you have seen about the attributes of the benzyl penicillin. It is the broad spectrum, it is the first choice drug, it is effective against most of the penicillin, but major setback it is that it having the poor absorption to the oral route. So most of the time it is given as an injection. Okay, let's see about the pharmacokinetics of the benzyl penicillin. So route of administration, it is given through the oral route. So different penicillin are absorbed to different degree depending upon their acid stability. Okay, so if because when it is given through the GI tract, the drug it is come in contact with the acid, and since it is the least stable to the interaction with the acid, so their absorption it is depending upon their acid stability. So if penicillin it is stable to the acid, then that penicillin will have the more stability through the oral route. Okay, then it can be given by the IM or IV injection. We have seen the reason, because it having the poor absorption through the oral route, and that is the reason why we are giving it through the IM or the IV injection. Okay, then scientists they have tried through other route, that is the intrathecal administration, especially because if you want to take drug towards the brain, because brain it is covered by the blood brain barrier, and most of these antibiotics they are least lipid soluble. Since they are least lipid soluble, so only option available is that you can give through intrathecal administration, so that you can bypass and drug can be sent towards the brain. So in case of the infection related to the brain, this can be tried. So intrathecal administration were given, and it was observed that intrathecal administration is inadvisable, particularly with the benzyl penicillin, as it can causes the convulsion. So that is the problem. So although you are trying to reach out that drug towards the brain, but after intrathecal administration it produces the convulsion. So although it is simple way to send drug towards the brain, but it may not be advisable because it having the risk of causing the convulsion. So only route available it is IM or the IV injection for the treatment of the infection if you want to use the benzyl penicillin. Okay, now let's see about the distribution of this drug. So it is widely distributed into the body fluids. It pass into the joints, so that is good, because if there is infection in the joint, you want drug to reach to the joint. So it can pass into the joint, it can pass into the pleural and pericardial cavity. So pleural cavity is present in the lungs, pericardial cavity present in the heart. So if there is infection related to lungs and pericardial, it can be treated because drug having good distribution in the pleural as well as pericardial cavity. It can reach to the saliva. So good distribution into the saliva, very good distribution into the milk. So little bit risky giving this drug to the breastfeeding mother. It can reach to the placenta, so pregnant woman. So if any teratogenic effect, although it does not have teratogenic effect, but still if the mother it is pregnant, then since it passes into the placenta, you should avoid it in excessive dose. Okay. And most interestingly, it do not crosses the blood-brain barrier. Why? Because the blood-brain barrier it is lipidic in nature, and this benzyl penicillin it is lipid insoluble. Since it is lipid insoluble, it do not crosses the blood-brain barrier. So this is about the distribution of the drug, and it is very important because if you are using it for the treatment of different organs and system, then the drug has to distribute it in those organs and system in order to produce antibacterial effect. Okay. Let's see about the elimination of the drug. It is eliminated through the urine. So the penicillin, it is eliminated through urine. Just a minute. Okay. So it is eliminated through urine, and most importantly, the penicillin having short plasma half-life, and since it having short plasma half-life, it is potential problem in the clinical use of benzyl penicillin, and that is the reason you have seen that we have developed different kind of penicillin which having the broad spectrum of activity and some also having the short spectrum of the activity. Okay. Now we'll move towards the activity, and I am expecting that you are giving answer especially in the chat box. Okay. So let's see our question one by one. You be ready to give the answer in the chat box. Okay, so my first question is, give mechanism of action of the penicillin. Let's see who give the first answer. So I have displayed your chat box. Mechanism of action of penicillin is your first question. Yes. Still no one has given the answer. So what it is doing, the mechanism of action, I am giving you a clue. It is something related to the enzyme. Very good. The first answer is given by the Amarjit Tiwari. Good. Tosif has also given the answer. What it is doing basically, it inhibits the binding site of peptidoglycan. It is partly correct, but what exactly it is doing with the enzyme, that is most important. What is doing with the enzyme? Tosif has tried to give this answer. He has mentioned about the cross-linking of the peptidoglycan. Actually, it inhibits the cross-linking of peptidoglycan, but how it inhibit? Okay, very good. So more precise, the answer it is given by Muhammad Talha. It produces inhibition of transpeptidase enzyme. So this is the key mechanism of action of the penicillin. Okay. So since it inhibits transpeptidase enzyme, that is responsible for cross-linking of the peptidoglycan and their bacterial cell wall structure. Okay. Since there is no cross-linking, there is lysis of the cell wall, and due to lysis of the cell wall, there is death of the bacteria. Okay. So this was the mechanism of action. I want answer should be flooded in the comment box. Still, I'm seeing the most of you are inactive. You are not giving the answer. Those who are inactive, please note that you may not get your attendance. I am not just giving attendance for only those who have just put one comment. The attendance it is for those students who are active till last question and last part of the activity. Okay. Let's move on to the next question. So my next question is, who is the investigator of the penicillin? Yes. So we have seen in case of the story of the penicillin, who is the investigator of the penicillin? Very good. Now I can see slowly students have started giving the answer. Good to see that you are active. Come on, who is the investigator of the penicillin? Very simple question. Very nice. So 20 PH 64 mentioned that it is Alexander Fleming. Okay, very good. So Alexander Fleming, Sufyan, Shagufta, Amarjit, okay, Shoaib Patel. Kind request all of you to please rename yourself with the roll number. Very good. So Alexander Fleming. So this is very good question, and it is very what we'll say. Most of the time, it was also asked in the GPAT examination. So you must remember, the Alexander Fleming is a scientist who has discovered penicillin by serendipity. That is, by accidental discovery of the penicillin. My last question of this first part of the session: what is potential problem in clinical use of the penicillin? Yes. What is the main problem with the clinical use of the penicillin? And I will give you a clue. It is something related to absorption of the benzyl penicillin. Yes. The potential problem in the clinical use of benzyl penicillin. Once again, I am giving you a clue. It is something related to absorption of benzyl penicillin. Come on. Okay, so 20PS64 mentioned that it is unstable with the HCl. Okay, partly correct, but very specific answer is that Amarjit has given the answer. The GI tract absorption is very poor. So least absorption through the oral administration, it is the main problem related to penicillins. Okay, and due to this important problem, now what you are doing, the penicillin, it is generally given by IM and due to IV route, and that is the important problem related to penicillin. Okay, one more answer given by the Tosif, intrathecal administration. Tosif, what an answer you are given, that it causes the convulsion. So that is only with the intrathecal administration. It doesn't produce the convulsion if you are giving through the IV or intramuscular route. So the convulsion, it is problem with the intrathecal administration. So sending drug toward the brain, it is the major challenge in case of the penicillin. Okay, very good. Nice to see that you all are active in my first part of the session. Now I am moving towards my second part of the session. Now we'll see the clinical and therapeutic uses of the penicillin. Now when I say the clinical use or therapeutic use, here you need to remember two important things. First thing is that what is the clinical condition? Means what is the disease, and second one is that which penicillin you are using in that particular disease. Because we have seen different kind of the penicillin based on their distribution, based on their spectrum of activity. The different penicillins, they are used for the treatment of different clinical condition. Okay, so let's start with the first clinical condition, that is bacterial meningitis. Now you know what is meninges. Meninges, these are the protective coverings which is generally surrounding your brain and the spinal cord. So due to bacterial infection, if patient is suffer from the inflammation of this meninges, then condition it is called as bacterial meningitis. So here the preferred drug, it is benzyl penicillin. So you are using high IV dose of benzyl penicillin in the treatment of bacterial meningitis. Okay. Second condition, we'll see the bone and joint infection. So bone and joint infection, only the penicillin which can reach out to the bone and joint, it is the flucloxacillin. And we have seen the flucloxacillin, it's come under the extended spectrum penicillin also. So bone and joint infection, you are using flucloxacillin. So you must remember clinical condition and the type of penicillin which is used for that clinical condition. Let's see about the third clinical condition, the skin and soft tissue infection. So skin and soft tissue infection, you can use benzyl penicillin, can easily reach out. Even flucloxacillin can also be used. So if you feel that benzyl penicillin is not working, you can also go for the flucloxacillin. Okay. So this is in case of the skin and soft tissue infection. Animal bites. So in case of animal bites also, there are sometimes there is the infection in case of animal bites. So there also you are using some antibiotics in order to have the quick recovery. So you can use the co-amoxiclav. This is the combination of the penicillins. So you can use the co-amoxiclav as a drug or as a combination medicine for the treatment of animal bites. You can also use it for the treatment of pharyngitis, where there is inflammation of the pharynx due to infection related to bacteria. So you can use phenoxymethylpenicillin in case of pharyngitis. Otitis, this is otitis, it is inflammation in your ear cavity due to infection, bacterial infection. Okay, so that is called the otitis. So in case of otitis, you can use amoxicillin. So the amoxicillin is a very important drug. You may see their use in many clinical conditions. So you are using it in case of otitis, in case of bronchitis also, bronchial infection due to bacteria, you are also using amoxicillin. Pneumonia, okay, that is caused due to the bacteria causing the pneumonia, you can use amoxicillin. So there are three clinical conditions, that is otitis media, bronchitis, pneumonia, you can see you are using amoxicillin. Even in case of urinary tract infection also amoxicillin can be used. So either it can be the upper or the lower urinary tract infection, you can use the amoxicillin. It is very good antibiotics for the treatment of urinary tract infection. Okay, so these are different therapeutic uses of penicillin antibiotics. So sometime for the 2 marks such kind of questions come in examination. So they may ask you like write clinical uses of penicillin, or they may ask you to write about therapeutic uses of the penicillin. Okay, there are few more clinical condition and therapeutic uses of the penicillin, like in case of the gonorrhea, which is the painful urination and pain around the urethra. So again, you can see the first choice drug, it is the amoxicillin. So there are n number of clinical uses are there for the amoxicillin, and that is the reason in the market, if you look at the leading brand or maybe the leading molecules amongst the penicillin, it is the amoxicillin. So every physician, since it having broad spectrum activity, they prescribe the amoxicillin for the treatment of many clinical conditions. Likewise, in case of the syphilis, which is systemic infection caused by Treponema pallidum spirochete, you can use the procaine benzyl penicillin. So in case of the syphilis, procaine benzyl penicillin. Okay. Endocarditis, which is serious infection with the Pseudomonas aeruginosa. Okay. So it is very severe kind of the infection because something related to the heart, and since heart it is the major organ, you should take special care of such kind of the infection. So here you are using piperacillin for treatment of endocarditis. Okay, so although most of the clinical condition which are related to inflammation, and this inflammation, it is happening due to the bacteria, because whenever there is bacteria in the body or the different part of the body, that part of the body will try to fight against those bacteria, and during this process there are release of the inflammatory mediators, and it causes inflammation of that particular organs and the system. Okay, so we have seen about therapeutic uses, we have seen about n number of clinical condition and the use of different penicillin. So most widely used penicillin among this, it is the amoxicillin, and even if you look at the leading brand, you may see the amoxicillin, it is used either single drug or sometimes it is also used in the combination. Okay, so this is all about the therapeutic uses. Let's see about the unwanted effect of the penicillin. So penicillin are relatively free from direct toxic effect. So although there is no direct toxic effect on the organs in the system, but still it having few side effects. So the main unwanted effect of the penicillin, it is hypersensitivity reaction. So you have to be very cautious if any drug it is allergic to the penicillin. So always remember, the hypersensitive reaction is not common to all the patients. There are few patients who are hypersensitive to the penicillin, and only those patients will show such kind of reaction. Now let's see what exactly happened in case of hypersensitive reaction which is related to penicillin. So here what is happening, so in case of the degraded product of the penicillin, or you can say it is metabolite of the penicillin. Okay, so the metabolite of the penicillin, what it is doing, obviously after the drugs goes into the systemic circulation, it will be converted into different metabolites. Okay, and these metabolites are called as the degradation product of the penicillin. So this degradation product of the penicillin, it combine with the host protein. Okay, so it is combining with the host protein of the patient. Okay, and once it combined with the host protein of the patient, what it further does, it produces the severe kind of hypersensitivity reaction. Okay, now we'll see also what are different hypersensitivity reaction which happens after the combination of especially the penicillin with the host skin protein. Okay, Just a minute. Okay. So there was some problem in the slide. So hypersensitivity reaction caused by degradation product of the penicillin, and this degradation product of penicillin, what it is doing, it combine with the host protein, and after combining with the host protein, the combination of the degradation product of the penicillin and this host protein, this combination, now it become antigenic. Okay, and there is a very simple principle of antigen antibody reaction. Now, this is not happening in all patients. It is only happen in case of the patient who are hypersensitive to the penicillin. So this reaction also happen in those patients. Now, in those patients, the combination of the host protein and degraded product of the penicillin, now it is acting as an antigen. And you know that whenever there is antigen, what body will do? Body will releases the antibody. Okay, and now there will be antigen and antibody reaction. And due to that antigen antibody reaction, the body will start showing different symptoms. Now, since it is happening in the skin protein, now patient will show the symptom like the skin rashes and the fever. There could be possibility of the delayed type of serum sickness in case of that patient, and also severe kind of allergic reaction, that is acute anaphylactic shock, can also be seen as one of the symptom of the hypersensitivity reaction. Okay, so to summarize, the penicillin directly not producing hypersensitivity. It is the degradation product of penicillin bind to the host protein, and now once it bind to the host protein, this combination become antigenic, and now there will be release of the antibody. Okay, and due to release of the antibody, now the patient will show the symptom like the skin rashes and fever, delayed type serum sickness in some patient, and also there could be a possibility of acute anaphylactic shock. Okay, so these are the few symptoms of the hypersensitivity related to penicillin. Okay, so the one of the important unwanted effect, it is hypersensitivity reaction. Second unwanted effect, which is seen in case of broad spectrum penicillin when it is given orally. Now, what happens when you give broad spectrum penicillin orally? You know that since it having antibacterial effect, and in your GIT you have bacterial flora. These bacterial flora help you in a digestion. Okay, so because some useful bacteria, they are required for the digestion of the food. Now, when broad spectrum penicillins are given, in addition to kill unwanted bacteria, it also kills the bacterial flora. And since it kills the bacterial flora, now that patient will suffer from gastrointestinal disturbance. So this is one of the major problem with the use of broad spectrum penicillin. Now, if you are giving broad spectrum penicillin, now to overcome this adverse effect, you need to give the external bacterial spores. Okay, so there are many bacillus subtilis, so their capsules are available. So if patient is suffering from gastrointestinal disturbance, you can give the capsule of those bacillus so that there is no gastrointestinal disturbance in those patients. Okay, so these were the symptoms related to adverse effect of the penicillin. Okay. So let's have last part. This is the last activity of today's session. Okay, Q&A. So my first question is that name penicillin used for bone and joint infection. I'm expecting your answer in the chat box. The penicillin which is used in case of bone and joint infection. Let's see who give first answer. Very good. 20 page 64, 20 page 104, Amarjeet. Very nice. Only 2 students have given the answer. What about other? Okay, Tosif mentioned about flu. Okay, it is flucloxacillin. Tosif, please correct the spelling. Shruti, Sufyan Kazi, Shifa, Shoaib Patel, very good. So flucloxacillin, it is used in case of the joint and your bone infection. So it is little difficult to treat because infection it is into a joint which is the deeper part of the body. Even bone it is the deeper part of the body. So you are using the penicillin which is having very good spectrum of the activity. Okay. Give few clinical uses of the amoxicillin. So we have seen that amoxicillin is having many clinical and therapeutic uses. Please let us know what are the few clinical uses of the amoxicillin. So I expect at least 2-3 clinical uses of the amoxicillin in this chat. So let's see who give the answer. There are many students who are still inactive. So flucloxacillin, this answer it is given by only 10 to 15 students. What about others? Okay, so first answer it is given by Shagufta, otitis, pneumonia, bronchitis. Okay, Amarjit mentioned about syphilis. Very good. Shruti mentioned about urinary tract infection. That is good. Pneumonia. Okay, gonorrhea you are using. Syphilis. That's great. Treat bacterial infection is general answer. It may not give you a marks if you are writing just treat bacterial infection. You have to mention about clinical condition. Okay. So Sufia and Sufyan Sheikh mentioned about just treat bacterial infection. That is not sufficient. Otitis, very good. So otitis it is the infection in the ear cavity. Okay. So almost most of the infection clinical uses of amoxicillin have been covered. My last question is, what is the main unwanted effect of the penicillin? So we have discussed today 2 unwanted effects. So out of this, which one is the main unwanted effect of the penicillin? Yes. Okay, so 20PS64 mention about hypersensitivity reaction. That's good. Amarjit mentioned about hypersensitivity reaction. Okay, so it is the major the problem related to penicillin. And second problem also we have discussed in case of broad spectrum penicillin, what it does, it produces GIT disturbance by killing bacterial microflora in the GI tract. Okay, very nice, wonderful. That's great. Okay. So I have done with my today's session. So I have referred the HP, Rand and Dell these textbooks. So you can go to 625 and 626 page. I will be uploading this book on the Google Classroom. Maybe today I will see that Google Classroom has been made for your class, and I will be uploading all relevant books over there. So always after the class, go through the content for the from the textbook. So that is my strong recommendation to you. Okay. This is the disclaimer for today's session. So thanks for watching my session. For more such learning, subscribe to my channel.